So we have revised clinical uh, physiology as much as possible. So just go and practice for these hematology experiments. So just to recall, what are the experiments? Differential leukocyte count, estimation of hemoglobin, estimation of blood groups, and bleeding time. Separate topics: blood grouping, determination of blood groups, not estimation. The word should be determination of blood groups, estimation of bleeding time, and clotting time. So differential leukocyte count, as per the what you have to perform, differential leukocyte count actually involves staining, preparation of the smear, staining, and count. Now if there are still okay, I complete the topic first. Total count of, that means red blood cells, total count of white blood cells. Among these you are to perform. So if the experiments which take a short time to complete, usually in the exam it is followed that even 1, 2, even 3 experiments you may have to do. Example, blood group, BT, CT, or the estimation of hemoglobin and together with BT, that is bleeding time. BT is bleeding time, CT is clotting time, or estimation of hemoglobin along with clotting time. Blood groups, bleeding time, clotting time, all for the exam purpose. Or if it is a longer experiment which takes time to complete, usually differential leukocyte count, which involves making the smear, staining it, and then counting the cells, that comes singly. That is given singly in the exam. Now, if this is as it is usually done, if it is up to the convener to change it during the exam, as still you are facing exams in your the institute, at the institution you are studying in, this becomes a, at least this bit of knowledge you know that this will be given single or multiple. But if the exam center is elsewhere, if that kind of circular comes, if that kind of rules come sometime, then it is up to the convener of that examination center. So never take it easy. Here also the convener has the authority to change, but usually as you are appearing for the practical exams in your own institution, so usually it does not change year after year. We are following this. We just give an hint to the students that this will be this, but there is no hard and fast rule about this. Practical exams, 60 marks and 40 marks, this is how the university has divided, and on the day of the exam 60 plus 40 marks you have to appear for 5 hours. That is the university rules. NMC has given the guidelines, university is giving the rules. But how that 60 can be decided on the morning of the exam by the convener. There is no hard and fast rule that the students have to be informed beforehand. But for your sake, we try to inform. So one experiment or 2 experiments or 3 experiments, this time in the third internal assessment also, and in the final we try to keep like the 20 hematology, 20 clinical. Still that has not been decided. But hematology experiments you have to face. Now, if anybody is still remaining who has not done one sum or the other, even a single time, then I'll suggest go for that, because without practicing, even the easiest you cannot do. If somebody has not done bleeding time, okay, it is easy, it is easier, simpler than the others, but still do that. Otherwise, if everybody has done everything, then I'll ask you to practice among whatever time you get among DLC, total counts, RBC, WBC. If you have done, now it is up to you. But it is up to you. It does not mean there will be no discipline, it will be chaos. So if you have to make 3 or 4 groups, then you have to organize it yourself. I'll do DLC, he will do bleeding time. So with a single lab technician at a single faculty, it is not possible to arrange that. And more so, it will become a chaotic in the table itself. So there are how many, 15, 16, you can use the available resources, but you have to modify it like that. You make a group and then tell, oh no, even within the group you don't come to a consensus. You make a group that we will do this together first. Okay, if time permits, then we will do that also. But you make a group, we are not making it hard and fast. Then it will be more cumbersome. Roll number 1, 2, 3, 4 go together, but roll number 1 wants this, roll number 2 wants to do that. So you make among yourselves, but within yourselves you have to make a consensus that now we'll do this together for the practice part. In the exam you have to do alone. And I always suggest keep the books with you for this purpose, practical purpose. Don't carry theory books with you, but for the practical purpose, keep the books so that you can have a ready reference, not for the exam, for the practice sessions. So I think we can proceed. We don't need to, if we go on to discuss again, just even the summary of all the experiments, it will take 30 minutes, 45 minutes gone over here. So carry the books. If any problem, we are there to help. But keep that in mind. If you have not done one thing, if there is anything left, I have never attended the classes, I'll suggest first go for that in that topic. And if you know, no, I have attended all, then I think you should go for DLC or total counts. Because blood groups, yeah, at least once you have done, I think blood group BTCT, once you have done, you should not forget. At least the priority at those. But if you have not done, then even the simplest experiments you should do now within these 2 days. And if you think, okay, I have done all, I need no practice, I'll be absent. If somebody thinks, okay, I do today whatever, it is up to you. That is, I can personally say this, not going by the rules, it is up to you. On Friday, I won't come, okay, I am confident, I'll utilize that. From my side, it is okay, but I don't know what is your attendance status, that is you have to consider. So then you come. I would suggest these 2 hours, I don't think, if you can utilize, it's okay. But as classes are going on and this time it is short, even the exam has been preponed. So I think it will be better you attend classes till the last day, whatever opportunity you are getting. After this, there is no guarantee to kichuti nahi, but whether we'll get time or not. If NEET exams have already occurred on the 21st of June, although it has been postponed. As it has been postponed, there is a possibility that students, the next batch won't be admitted before your batch at least sits for this exam, before 3rd September that is. There is no option for even revision classes. That is stupid to think like that. After 3rd September, up to 2nd September, maybe up to mid of August, there may be some revision classes. But if this batch would be admitted in July and would start classes from August, it would become more cumbersome. There would be no time for revision classes because the department would become busy with that. But that will not happen only because the exams have been postponed. Okay. So hearing this, don't encourage the students again, next batch to themselves go and leak the paper next time so that they get time for revision classes. But it has happened, so happened. This is a joke, but this has happened. So I think before the next batch enters, we can devote, all these departments can devote the full time, whatever time will be possible to devote for this batch. But after the COVID, this has gone haywire. So this is the situation. If sometimes batches coincide, this has never happened with the first prop, but this has happened with the second phases. Batches have coincided. That batch has not still sat for the exam, but I don't know what will happen this time. This has happened. So 2 second prop batches, and the department has to make the academic routines have been made like that, and that has turned into at least a bit of chaos. So some people are doing classes in the first half, same department. The second half, this becomes a chaos. And the department has no other option also. They have to focus on the next batch also because they will also have limited time. Not that, okay, for 2 months, you just sit around and just roam the department, go away, we're going on the old batch. So for you, that will not be the case. Maybe up to the mid-August, or 20th of August or so, we can arrange some revision classes if the students want or if the department thinks so. Some time will be there, but again, there is a tendency of many students that now nothing is needed. Now I'll go home and uh, read for the theory. That is not a bad idea, but what happens is practical revisions, only that time is left. Between theory and practical revision classes usually not possible. Sometimes only 2-3 days remain. This time I think there will be 7-8 days, but how many of them will be working days and all these things come into the equation. So that is not a very good idea. Whatever will be within mid-August. So if somebody goes home, that time attendance is not being counted, except those still before sending to the university, those persons attendance will be counted. This we have seen. Those who are lagging, if that is recoverable, sometimes that is counted. That come and sit in the lecture hall and that is your attendance for 5 hours today. If you are lagging at it, that is how the institutions try to make it up. That you have not attended, you are this percentage short, so come and sit in the lecture hall. Otherwise, nobody is bothered. That is your study time, what you are doing before the exam, this 1 month. But again, this would not be possible from the next year onwards. In your medical curriculum, I'm not talking about anatomy, physiology, biochemistry. Because what happens, even if you are facing the pharmacology, microbiology, pathology exams, clinical classes for the final year subjects, clinical classes go, there is no gap. Okay, that is just an unofficially, students won't attend for the last 7-10 days. Don't talk. Yes, you just listen to these things. This will not needed immediately, but so clinical classes go on during each curriculum. You are sitting for the second phase exam, maybe for the last 7 days, students themselves don't attend, but clinical classes curriculum is there. So there is no off day actually. It is the first prof or where you get some off days. It is your choice whether if your attendance is okay, how you prepare for that last 15-20 days is your choice.